Hello viewers, how you doing today? Hope you are doing great. My name is Harrison Chiebuka and you're welcome to this episode of the show. Today we'll be talking about health, to be more specific, sexual health. Okay? There's so many things that comes into play when we're talking about sexual health. But today I want to be specific and what are the things you're supposed to do immediately after you have an unprotected sex or condom failure? Most health professionals don't talk about this topic, but today I want to be more specific and exclusive. First of all, you are not going to panic, but if you stick to the end of this show, you're most likely to be thankful. Watch this video and try to hit the subscribe button and like and comment if you do find this helpful. Thank you. Stick around. See you I recently received a call from a close friend informing me that he just had an unprotected sex and wanted to know the next thing to do. Sex is meant to feel really good both physically and emotionally when there is good communication about protection. But sex can also bring concern and worry. Unprotected sex can lead to unplanned pregnancy or STDs, including HIV. Sometimes people don't use protection, maybe they were using drugs or drinking and didn't think about it. Sometimes the people using contraception make mistakes and it didn't work correctly. Perhaps the person was sexually assaulted. But whatever the reason was, it's important to be aware of the dangers of unprotected sex and be proactive so that there are no problems later on. Emergency contraception, also called the morning after pill or Plan B. A pill you can get from a family planning clinic or be bought on a drugstore or pharmacy. Remember, this pill is an emergency pill and not to be taken regularly as a regular contraceptive pill. It's not an abortion pill. Emergency contraception can help prevent pregnancy when taken up to 5 days after unprotected sex or birth control failure. The sooner it's taken, the better it works to prevent pregnancy. Another option is that a healthcare provider can insert an IUD. IUD stands for intrauterine device, a small T-shaped device which is usually made of copper and plastic. It's one of the most effective ways of preventing pregnancy with up to about 99% efficiency. An added advantage is that once you get an IUD inserted, it works as a continuous contraception in future also, but neither of this method prevents STDs or HIV. Next to the important part is the prevention of sexual transmitted infections after the unprotected sex. If you notice that the condom broke, stop any sexual activity and move away from your partner. First, head to the bathroom to remove lingering fluids from the vagina, penis, or anus. This can make you feel comfortable and help remove bacteria that could result in urinary tract infections. Peeing can also help. Do not douche, but do wash up. This may reduce the risk of infection, but it's still not foolproof. Do a pregnancy test 2 to 3 weeks after unprotected sex. Take an appointment with your doctor as soon as possible. Most of the people do not want to talk about sexual transmitted infection, but it's very important to talk and seek help at the right time. Many of the STI can be very simple, like chlamydia, Neisseria, gonorrhea, trichomonas. These are very easy to treat, while some can be very difficult to treat, like hepatitis, herpes, and HPV. These are practically non-treatable. The risks are high, especially when the sex occurred without a latex condom. Though STI can happen after vaginal, oral, or anal sex all the time. But some symptoms to look out for are painful body, dirty vaginal discharge, pain, fever, itching, pain in the lower abdomen, or even painful urination. If that happens, you need to seek help from your doctor as soon as possible. Always complete the course of antibiotics which has been prescribed by the doctor to treat UTI. In case you are suspecting your partner to be HIV positive, then it's important to seek help of what is known as PEP, post-exposure prophylaxis. It's a medication that can be used in an emergency if the person has been exposed to HIV. PEP must be started within 72 hours after unprotected sex. PEP can be hard to get, but it can also be available from a healthcare provider like your doctor or a family planning clinic or the emergency room of a hospital. This medication is to be taken for a period of 28 days. Talk to your partner about the doubts you are having. Lastly, using contraception and condoms every time you have sex is the best way to protect yourself and your partner against unplanned pregnancy and STDs, including HIV. Many times, things don't happen the way as planned. Accidents do happen, but it is wise to be proactive and seek help at the right time to prevent further complications. So today, if you found this information helpful, please like, share and subscribe to this channel. Stay safe, stay healthy. I'll see you soon.